Vitamin D3 deficiency is associated with a huge number of diseases and disorders such as obesity, depression, heart disease, arthritis, high blood pressure, AFib, and the common cold. Did you know that IU is a measurement of vitamin D, and IU were actually invented by Big Pharma to confuse the public to prevent them from taking high dose of vitamin D3 and instead utilize Big Pharma's expensive drugs? 20 milligrams of vitamin D3 is equivalent to 1 million IU. Vitamin D toxicity is very rare. Even if consumed 1 million IU daily for 30 days, there was no toxicity of changes in blood work or body performance. Less than 5% of the population have a sensitivity to very high vitamin D dose. And of course, every half hour your skin is exposed to the sun between the hour of 12 to 3 p.m., you can absorb up to 25,000 to 30,000 IU. I became to investigate even more, especially was little concerned about the increased incidence of atrial fibrillation occurring in people with D3 levels over 100 or 120. So I did a little research and I discovered that warfarin, which is a drug more like rat poison, they give people at risk of blood clots. So it prevents clots by inhibiting vitamin K1, which helps for blood clotting, but it also inhibits K2, which can prevent AFib. It turns out that warfarin users have a high incidence of atrial fibrillation due to K2 inhibition, even thought this is a drug to prevent the bad effects of AFib like stroke by inhibiting K1 clotting. But both warfarin and high levels of vitamin D3 both can trigger atrial fibrillation by eating up your vitamin K2. So make sure you take vitamin K2 if you decide to conduct this experiment on yourself. Now, those to be consumed to stay on the safe side and at an optimal level should consume 1000 IU per 25 pounds of body weight. For example, if you weigh 100 pounds, divide that by 25 pounds, that's a total of 4 multiplied by 1000 IU. That's a total of 4000 IU daily in the summertime, and in winter season or lack of sun, add additional 2000 IU. If you are planning to take more for experiment purposes, please do consider adding K2 to prevent AFib and magnesium for better methylation. In addition, if you are interested in doing that home vitamin D3 testing, I did list the link under blood test with a 30% discount. And if you know someone with atrial fibrillation who is possibly taking warfarin, please consider sharing this video and you can literally change someone's life. If my videos helped you improve your health in a small way, please consider funding me $1 or $2. Therefore, I can have more time and research for more videos.